Good afternoon. My name's Dr. Jeffrey Gunzenhauser. I'll spell that for you, Jeffrey. Last name is Gunzenhauser. As Chris mentioned, I'm the Interim Health Officer for Los Angeles County. I'm an employee of the Public Health Department, which is part of Los Angeles County's health agency. So I want to thank all of you for participating today in this press event. The purpose of today's briefing is to provide you up-to-date information about the increased number of invasive meningococcal disease cases that have occurred recently in Los Angeles County and in Southern California. So I want to thank all of you in advance for any assistance you can offer in getting out information so we can increase the number of people who are at risk and should get vaccinated. The four take-home messages that I would like to emphasize right up front are the following. First, meningococcal disease is very serious. Second, the current cases are disproportionately affecting men who are gay or bisexual. Third, there's an effective vaccine that's available to anyone who's at risk for this disease. And finally, it's critical that we work together very quickly to increase the levels of vaccination among the at-risk population. The LA County Departments of Public Health and Health Services are partnering with a broad cross-section of local jurisdictions and community-based health partners who serve both HIV-negative and HIV-positive gay and bisexual men or men who have sex with men to increase the rates of vaccination for invasive meningococcal disease. Today, standing with me up here are partners, including representatives from the LGBT Center right here, APLA, Health and Wellness, and the AIDS Healthcare Foundation. I want to talk to you a little bit about meningococcal disease. It's a rare disease, but it's a very serious infection. Some of the consequences that it can cause include swelling in the brain and spinal cord, loss of a limb such as an arm or leg, deafness. It can cause brain damage and even death. Meningococcal disease is caused by a bacteria named Neisseria meningitis. The form of illness caused by this bacteria that most of you may be familiar with is called meningitis. The bacteria can be spread to others through the respiratory secretions of people who carry the bacteria in their nose and throat. And those who carry the bacteria may not have any symptoms indicative that they're carrying it or that they have an infection. Meningococcal disease can start with common symptoms, such as you'll see with the flu. So people could experience a low-grade fever and maybe some body aches. But in some people, this could progress to much more severe symptoms, such as high fever, headache, a stiff neck, confusion, and rash. And in some people, this progresses to a very severe form of disease called shock, which can lead to death. Even when appropriately treated, about 10% of cases of people with meningococcal disease are fatal. Therefore, people who experience these symptoms should seek medical care immediately. In LA County, since May, the number of these infections among men, most of whom have identified themselves as gay or bisexual, is substantially more than we would normally expect during this time of the year. This is of great concern, and we want to ensure that individuals who are at risk get vaccinated and take other precautions to stop the spread of this disease. So the total number of cases of meningococcal disease in LA County in 2016 stands at 17, of which 12 have occurred in the last 2 months. 8 of these cases this year were identified in men who are gay or bisexual, and 7 of those 8 cases have occurred within the last 2 months. In LA County, there are an estimated 300,000 self-identified gay or bisexual men in a population of more than 10 million. 7 cases occurring among this group during a 2-month period is much higher than expected, and so we all must work together to do all we can to protect individuals who are at risk. The cases in Los Angeles County, including those in the city of Long Beach, coupled with the cases in neighboring Orange County, bring the total of number of cases occurring among men in Southern California since May to 15. To date, there have been no social linkages identified among any of the cases in Los Angeles County or the cases that have occurred in our neighboring jurisdictions. The reason for the high proportion of cases occurring among men who are gay or bisexual is unknown, but it's important to acknowledge that the majority of the cases occurring in this group are in men who are either HIV negative or in whom we don't know if they're HIV infected. While a recent health alert from the California Department of Health reported that there was one recent death attributable to this disease in Southern California, this death occurred in another county. Fortunately, there have been no deaths in LA County so far this year due to these infections. To protect the public's health and to prevent further spread of this disease to other individuals, it's imperative that we encourage vaccinations and take other preventive measures. The encouraging news is this: the bacteria identified from the majority of patients diagnosed so far are in a group that we call serogroup C. A very effective vaccine is available which can protect individuals from becoming sick from this particular group of the meningococcal bacteria. Therefore, in response to the recent increase in cases, vaccination is recommended for two specific groups. First, all individuals who are HIV infected are recommended to receive this vaccine. And second, all gay or bisexual men, regardless of their HIV status, who are at risk. And this would include men who regularly have close or intimate contact with multiple partners, men who seek partners through the use of digital apps, or men who share cigarettes, marijuana, or use illegal drugs. We encourage anyone who's at higher risk to seek vaccination from a primary care provider. If an individual is uncertain whether or not they are at risk, I recommend they check with their healthcare provider. I especially encourage all gay men who live in Los Angeles County to discuss this with their doctor. At this time during the period of increased risk, vaccinations can be obtained free of charge at public health clinics for all people at higher risk, regardless of whether or not the individual has health insurance. Vaccinations can also be obtained from a cross-section of county-operated and community-operated healthcare providers, including right here at the LGBT Center, or from other providers who serve the LGBT community. As the interim health officer for Los Angeles County, I want to especially encourage all of our healthcare providers and partners who serve this community to identify individuals who may be at risk and to recommend vaccination. Our public health website, www.publichealth.la County, includes a list of clinics where vaccine can be received, as well as their hours of operation. Even though vaccination is the best way to prevent the disease from occurring, to decrease the risk of transmission between individuals, we recommend that they limit certain activities that would spread saliva. As such, we strongly recommend that individuals don't share drinks, utensils, food, or toothbrushes, not to have multiple kissing partners, and don't share things you smoke, like cigarettes, e-cigarettes, cigars, pipes, or hookahs. So your Department of Public Health is continuing to work closely with the California Department of Public Health and neighboring health departments, as well as the Centers for Disease Control, to promote awareness and education and increase access to vaccinations. Investigation of this increase in the number of meningococcal disease cases is ongoing, and we have an expert from the Centers for Disease Control who arrived this week and is here working with us and assisting us in our local investigation. We'll provide you additional information about any additional cases and what we're doing to safeguard the health of those who are at risk. I encourage individuals who would like to speak with someone about their own risk and whether they should receive the vaccine to speak with their doctor, or for those who would like to do so, simply call the county's information line at 211, who can connect them with clinics or our local health centers. Also, for anyone who'd like to learn more about meningococcal disease and how you can get involved to assist us, you can visit our website at lacounty.publichealth.gov. thank you all for your kind attention. I'll be glad to take questions after we're finished.